Welcome to our online parent ed series on the topic supporting students struggling with depression. This is a video that was developed by our school social worker team, and the goals for today are to define what is depression in a clinical sense, to raise awareness of what the red flags are, talk about how it works, discuss the risks of not treating depression, and then end by giving you guys some really practical supports as parents. We want to start off by showing the statistic that 20% of adolescents are going to struggle with depression at some point. So that's a pretty shocking statistic. If you look at our typical class sizes right now, we're like 30 kids. So there's going to be like 6 kids in the class that struggle with depression on average. Luckily, this is much lower for children, but definitely still exists within children. A lot of people ask, what's the difference between feeling blue and actually experiencing clinical depression? The way depression is described according to the DSM-5, which is it's a diagnostic tool that therapists use. So 5 or more symptoms need to be displayed over the same 2-week period. They need to be a change from how your student was previously functioning, and at least one of the symptoms need to be depressed mood or loss of interest, and we're going to cover those symptoms in just a minute. The symptoms also need to cause distress or impairment socially, occupationally, or in other areas. So basically what this means is that the symptoms of depression need to be interfering with your child's everyday functioning. And then we need to make sure that they're not due to other medical conditions or mental health diagnoses. So when we're referring to these depression symptoms, we're talking about these 9 things right here. So a depressed mood for most of the day, nearly every day. So this can either be self-reported by the student or observed by other people around them. A diminished interest or pleasure in all or almost all activities most of the day or nearly every day. And this again can be based on self-report or observation. Significant weight loss or gain, both ways, or insomnia or hypersomnia nearly every day. So sleeping too much or sleeping too little. Also psychomotor agitation or retardation nearly every day. This can be observed by others. Fatigue or loss of energy nearly every day. Feelings of worthlessness or excessive or inappropriate guilt nearly every day. And this can be real or not. So they could just say, I feel like the worst son in the world. And this could be because they are not being respectful or not following boundaries in your home, or they could be, behaving exactly how you've asked them to, and they're just beating themselves up about something. Diminished ability to think or concentrate or indecisiveness nearly every day. Again, this can be self-report or observed. And then lastly, recurrent thoughts of death or recurrent suicidal ideation or suicide attempts. We want to break down more about what it actually looks like. So we're going to go over some red flags that parents can be keeping an eye out for. There's 3 areas of red flags that we want to bring your attention to. So emotional changes, behavioral changes, and then physical changes. So emotional changes would be emotional flatness. So not having really any highs or any lows, just kind of being flat is the best way to put it. Hopelessness, exaggerated self-blame or guilt, isolation, so withdrawing from people, self-hatred, confusion, helplessness, and a lack of interest in pleasurable activities, hobbies, work, or social activities. When it comes to behavioral changes, we want to look at, are they neglecting their appearance? So maybe not showering, maybe a decision to not wear makeup anymore. And this isn't like a conscious choice of, I've decided I want to go with another look. It's, I just don't care anymore and I'm not going to bother with it. Neglecting responsibilities, changes in eating and sleeping habits, like we talked about before, eating too little or too much, or sleeping too little or too much. Becoming disruptive, assaultive, hostile, irritable, or withdrawn. And then exhibiting self-destructive behavior, so self-cutting, drug and alcohol use, or promiscuity. When we're talking about physical changes, we're looking for, are they talking about aches and pains with no physical cause? Do they have a lot of weight loss or gain? And are they displaying a lack of energy? It's important to note that causes of depression can be both biological and environmental, and it's not necessarily one or the other. It's usually a combination of both factors. So when we talk about biological, we're looking at genetic vulnerability, anatomy of the brain. So genetic vulnerability, just because someone's parent has struggled with depression themselves doesn't mean the student is definitely going to struggle with it, but depression can be genetic, so they may be more likely to struggle with depression if someone else in their family has. Anatomy of the brain, so if your brain is built a certain way, you might be more likely to struggle with depression. A chemical imbalance, this is really common for a lot of people, and a lot of times these are the cases where we see medication being really helpful. Again, we're not encouraging or discouraging the use of medication, just giving facts about when people have used it and when it's been beneficial in the past. The student's temperament could be one factor, and then hormones. Obviously, anyone that has teenagers in your house knows that this is a big part of the teenage experience, and these can affect the chances of your child, developing symptoms of depression. As far as environmental causes, we can look at life adjustments or stress, so a recent move, a recent divorce in the family, any kind of stressor that's going on at home. A learning disability can make it really challenging for a student to be able to succeed in school. They might feel frustrated. Medical issues can also play in. If they're struggling with an ongoing medical condition, this can cause them to feel hopeless and overwhelmed. Past trauma. A lot of times students experience seasonal depression, so it's not necessarily something they experience all year round, but some students we find struggle more during the winter months. And then medication or substances. We'll talk more in a little bit about how substances can definitely produce symptoms of depression. So biological and environmental factors that influence depression. We also were often asked, doesn't it look the same for all ages? And the answer is actually no. Depression looks really different in kids, adolescents, and adults. A lot of times people kind of picture this sullen, downcast person as being depressed, and so they're confused when they don't see those symptoms in someone that's struggling with depression. So for kids, a lot of times depression looks more like irritability and awkward social skills. It can be a lot more somatic, so unexplained pains and aches. They can be extremely sensitive to criticism. They can display inattention and forgetfulness, and then also experience separation anxiety. With adolescents, this looks a lot more like mild irritability and defiance. There can be substance use, which, like we talked about before, can be something that causes depression symptoms, but also self-medication can lead to giving us a hint that someone could be struggling with depression. More risky behavior, low self-esteem, and boredom are what depression can look like in adolescents. Depression definitely impacts learning. Some of the ways it does this is that it makes it really difficult for the student to focus and concentrate. Low motivation can lead to skipping class and missed assignments. Memory problems can affect test performance as well. And then there can be a lot of forgetfulness around assignments. There can be difficulty with abstract reasoning. And then it can also be challenging for them to make decisions and, for example, like what to write on a college essay. It can be really hard for them to get these assignments started or projects started because they just don't even know what to start with. Sadly, only 30% of depressed students are actually treated for their depression. There's a lot of risks involved when depression goes untreated. So we're going to spend some time reviewing what can happen when the depression goes untreated. The first thing we want to call your attention to is substance use. This is pretty classic, especially for adolescents. What we're seeing a lot of is when depression isn't managed, students feel really discouraged, and so they think, hey, I heard that when I smoke marijuana, I can feel better, I can feel more relaxed. This is going to help me feel less depressed. And so they do that, and it does help for a little bit while they're high. However, when the high wears off, it actually worsens the depression and leaves them feeling even more depressed than they were before. So it worsens symptoms, and it actually increases risk of suicide and reckless behavior. Suicidality is a big issue that can happen. if depression goes untreated as well. So sadly, suicidality is not always planned, and the risk is 20 times higher for people that struggle with depression. It's really difficult for people that are struggling with depression to think long term, and especially adolescents, it's already difficult for them to think long term. So just imagine if you also have this underlying mental health issue that's going on. We also know that there can be negative effects of SSRIs if students are taking that as an antidepressant. And so this is why when a doctor prescribes an SSRI, they always tell people, if you experience any kind of suicidal thoughts, call us immediately, because it means that that medication is not a good fit for you. So that's something to keep in mind. This doesn't always happen, but just something to be aware of. These are some suicide hotlines that are on the back of every student's ID card. So we just want to call your attention to these and let you know that they are available. The National Suicide Hotline is available 24 hours a day, 7 days a week. The text home to 741-741 is a way for students that might not necessarily feel comfortable making a call. They can text message. We also encourage students to call the Pleasanton Police Department to go and do a well check on a friend if they find out that they're struggling with suicidal thoughts. And then we have this call or text anonymous student support tip line. This goes to student services at the district office. So we encourage students and their families to use this number if they're struggling or know of a friend that's struggling, but we also want to make sure that you're aware of those other 3 numbers, because the student support tip line is only in use during regular workday hours for the school district. So if there's an emergency on the evenings or weekends, we encourage you to call these other numbers first. Physical health is also another component of something that can be affected if depression goes untreated. So we talked about all the physical effects it can have, like aches and pains, poor appetite, heart attacks. We're not saying that necessarily anyone that has depression is going to have a heart attack, but if you are not treating your mental health, it does have physical symptoms that can result in constricted blood vessels, weakened immune system, things like that, that can worsen your physical health. So that's something to be aware of. There's a lot of other things that can come from untreated depression, like low self-esteem. We see a lot of internet addiction for our students that have depression and they're trying to find a way to self-medicate outside of maybe drugs and alcohol. They are finding an easy way to do that with their phones and internet addiction. We also see eating disorders develop a lot with students that struggle with depression. And then, like we talked about before, academics can really suffer. In the next video, we're going to talk about some really practical tools for how you can actually support your student and how there is hope and that depression can be treated.